Reasons. There can be lots of reasons for this pattern, but this just that we found there. And about the triggers, like stress generally decreased the percentage of stress as a trigger, not in general. I think the phone application is like that. The patients report a headache, and there are some questions. Is there any trigger related to your headache that you are reporting? And there are lots of options that they can select. Another question is, how was the severity of your headache? Like, how was the durations? Questions like that. So stress as a trigger had lower percentages compared to previous years. Anxiety didn't change that much, but lack of sleep decreased as a trigger. So this pattern is interesting somehow. Like, it's a kind of just cross-sectional, we can say, study that the only thing that this study can tell us is there is a pattern. So what's the reason? We don't know. We have to check for it. Like, this data is from different countries. Mostly the users were from US, like about 50%, 45%, and the others were from other countries like UK, Canada, France, Germany, Australia, and several different countries. So we don't know what's the difference between countries at the moment. Maybe we have to check it. So there are lots of explanations for this. Maybe there are some other triggers that we have, but in the percentage is low, but it's increasing. So it has effect on the pattern, but we don't see them at the moment. Or maybe now the new users, like what I was thinking about is at the beginning, like in 2018, mostly maybe patients who had other comorbidities like stress, anxiety, were interested in using the phone application. But now at the moment, more patients, even without comorbidities, are interested. For example, we need to check several different factors, adjust for everything, like do subgroup analysis, like for different countries, different times. We know that the pandemic, the COVID-19 pandemic, it was the disease was considered as a pandemic in March 2020, I think. So our data is for April, January, February, and March. I think we should have to continue this study to see maybe there is a new pattern, there is a difference now after March. And even what I'm thinking about is maybe we should do another study, like have a sample of the users and do questionnaires, send them questionnaires, and like do migraine diagnosis based on, for example, migraine specific screening questionnaire, which is a simple questionnaire, and ask several questions, the same questions, and have the real responses, and compare different groups together, compare different countries, different times. Yeah, that's what may help in the future.